Hi, I'm Gary White for Channel 6 Television. I'm here again with Sara Jo, who is the Public Health Director for the Lincoln Trail District Health Department. And we want to talk about a program that will be starting, hopefully, needs to get final approval, and there's still some work being laid out, but it's looking like there will be a needle exchange program that will be starting up in Bardstown and Nelson County, potentially in the middle of your new fiscal year, possibly in July. So we'll keep you up to date on the progress for that, but we want to talk about how this program came about and what the needle exchange program is, so that people can understand the purpose of it and how it all works.
Okay.
So this program actually became a possibility back in 2015, I believe, right?
Right. Senate Bill 192 was enacted in the 2015 regular session, which amended a statute allowing local health departments to operate what Kentucky has coined the term Harm Reduction Syringe Exchange Program. So you'll see that acronym HRSEP, but it's basically a syringe exchange program. This was done in response to Kentucky's rising issues with hepatitis C and Kentucky's increased issues with drug use. And so we knew that this was we had a potential for increases in HIV and hepatitis C, and that we had increasing overdose deaths in Kentucky. And so this was done to help prevent the spread of disease, basically. And so right after that, in February of 2016, Lincoln Trail District Health Department began what we would term an assessment process. And what we did is we began studying syringe exchange programs, both at the national level and some of the local ones that got a very early start, like Louisville Metro Health Department's syringe exchange program. And we also started conducting meetings in each one of our counties with community partners. We wanted to know what trends they were seeing in drug use, drug abuse, arrest, those types of things, treatment services. We wanted to know what that local pulse was, and so we did those meetings in each one of our counties and began gathering also statistical data for each one of our counties.
Okay. And then you actually, from that point, you also did presentations. I know locally here in Nelson County, and you also did one at Marion County Fiscal Court, and then also at Bardstown City, correct?
So as we gathered that information, we tried to begin education and informing both the public and elected officials on what we were finding. And so we did do some presentations with fiscal courts and city councils, our boards of health, informing them of what we were finding as we were doing our assessment process. And that began in the spring.
Okay. And then it was actually officially approved in Nelson County and with the Bardstown City Council in December, is that correct?
That's correct. In October, we felt like we had a very good idea where we needed to begin our program. Nelson County was coming to the top based on data and risk, but also based on readiness, community partnerships, stakeholder buy-in, all of that was kind of lining up in Nelson County for us. And so in November at our District Health Department Board of Health meeting, we went ahead and got approval from our governing Board of Health, which was the first step in the approval process. And then in December, we were invited to the Nelson County Fiscal Court, and we got approval there. And then shortly thereafter, Bardstown City Council also approved the program.
Now, when we talk about the needle exchange program, let's talk a little about what that is. What do you foresee that program doing?
It can look like many different things. It can be as simple as needle exchange, or it can be very comprehensive. And so what research tells us, and we look at that to determine what we need to do, we really want it to be a comprehensive program that not only provides for the proper disposal of contaminated syringes, so we want to remove those out of our community. We want to reduce the risk of spread of disease from needle sticks and injuries like that. But we also want to provide clean syringes to those who are using injectable drugs, so that they're not sharing needles and they're not spreading disease, and that they're not creating injury from doing that. but also testing for bloodborne viral infections like HIV, like hepatitis C, so they know their status. If they need healthcare services, linking them to those healthcare services and getting the necessary treatments that they need. And also providing a linkage to treatment and social services so that they do have a better opportunity to get off of drugs and rehabilitate.
So it's really, when we talk about it, it kind of really could be something that can help or benefit anybody because, yes, you're giving the needles to the person who's using drugs. However, when you give that, they have to bring those needles back, correct? Which takes those used needles off the sides of the road or anywhere else that they may end up or in somebody's trash that somebody may actually come encounter with. So
it really affects the total population of the community in which it serves, not only by removing the potential to be stuck by a contaminated needle in the community, and for those response agencies like law enforcement and EMS. But also, whenever you can reduce or control disease rates in the community, you also reduce other individuals' risk for contracting those diseases. So if we can prevent the spread of HIV and hepatitis C in the population that's using injectable drugs, that doesn't just benefit that population, it benefits everyone that may have some type of exposure to that.
Right. Okay. So the process now for this, it's been approved by the Bardstown City Council and the Nelson County Fiscal Court to possibly be started here in Nelson County. Now that program will be, obviously it's for the residents of Nelson County, but really it's an anonymous program that anybody in our Lincoln Trail District could utilize. Is that correct?
That is correct. It is an anonymous program that does help with participation in the program. The other thing is, one thing that public health professionals know better than anybody is diseases don't know the boundaries of county lines. And so by helping anyone that's willing to participate in the program, whether they currently reside in your community or not, will still benefit you.
Right.
So yes, there is some anonymous things to it. We do want to track some data so that we can report that out to our Board of Health, to our community, and also to the legislators about the success of the program. So we will track zip codes and things like that. How many referrals we're able to make, how many positive tests, those types of things. But Kentucky's working on standardizing what type of data you collect right now.
Okay. Now, we had talked about there is still a process before this would start because it potentially could start in July. What's that step? What's the process here?
We really want to ensure that we are successful with this program, and we believe that while Lincoln Trail District Health Department will have by statute, the authority to oversee this program and administer this program and will be responsible for this program, we really feel like that we need to involve our stakeholders from the very beginning, which we've tried to do in the assessment process, and we will continue to pursue that as we look at how we're going to conduct this program. So we're hoping by the end of February that we'll be able to gather a stakeholder group they'll come in and participate in the process of how we will develop guidelines. We want to ensure that if we make referrals to social services or treatment services, that those are very smooth, healthcare services, those types of things. And so we want that participation from the beginning. Once those guidelines are developed, we would like to take them to our Board of Health for final approval because they do have to oversee the program. So that will more than likely be at the May meeting to be operational by July 1st, which will coincide with the beginning of our fiscal year. We also would like to use that stakeholder group to not only help in the beginning in the development of the guidelines, but also to evaluate the program after it starts, perhaps on a quarterly basis at first, to see were there roadblocks, were there issues, what can we do to refine the process, because with any new program we realize that there'll be adjustments in the beginning. Absolutely. And we'd really like to be able to identify those and communicate those and work as a community toward resolving them.
Now, also with the actual program itself, the details will be worked out, but it will, when it starts out, somebody comes to the facility anonymously. And where that's going to be is still yet to be determined, somewhere in Nelson County, but where.
Right.
And they have to give you the needles that they use eventually, and then you give them needles that they have to then bring back. Is that how this works?
It's a weekly participation.
Okay.
And so we will supply the individual with 1 week worth of supplies. The very first time, typically research tells us, not to require the needles the first time they participate because you want to get them participating and engaged, and eventually you build accountability as they participate in the program. But yes, the goal is to get to a one-to-one exchange where you're receiving, for every one syringe you receive back to dispose of properly, you're giving out one clean. So that is the goal with that. And they're also offered services, testing services, those types of things at that same encounter, and education. So what all those services will be is to be determined. At minimum, I would like to offer hepatitis testing, as well as HIV testing, as well as pregnancy testing if we needed to do that.
Now, you had said, I believe, that this type of program is obviously it's new to Kentucky as of 2015, but programs of this sort have been around since the 1980s. Is that correct?
That's correct.
And data shows they work, or not?
The data shows that it works, and the data dispels a lot of myths that surround syringe exchange programs. They don't increase drug use in the community. They don't increase crime. They don't inspire those that are not using drugs to begin using drugs. So they've been proven safe. They've also shown that participants in syringe exchange programs are 5 times more likely to seek treatment than those who do not. And they also have shown over and over again that they reduce risky behavior in those that inject drugs.
And we know, just I believe it may have been like last year or so, that not too far away, less than 100 miles away or so, in southern Indiana, there was a huge outbreak of HIV in that community, which is linked somehow to
injection drug
use. So this is hopefully a way to prevent something of that nature occurring in our area as well. Is that correct?
And that's what we're trying to do, is we're trying to be proactive. We don't want to wait for something like that to hit our community and then go through this process in response to that. Right. We would like to go ahead and go through the processes, be able to take our time, do it right, and then be prepared, and hopefully prevent anything like that from happening.
So that's about the needle exchange program, and I've been talking with Sara Jo Best with the Lincoln Trail District Health Department. And again, it will be started, hopefully it looks like it will work, that it will start in Nelson County sometime in 2017. And all the details are still to be completely figured out, but it's looking about mid-2017. And then how long will it take for data for it to be determined whether it's successful or not in our community?
That's a tricky question in public health, because participation will drive some of that. Typically when we begin these programs, it takes a while for participation to happen. A lot of that, I believe, has to do with trust. But as the participation increases, because the numbers increase, you can tell more about that. The other thing that's happening right now is Kentucky Department for Public Health is creating standards for all health departments that are participating in these types of programs, a standard set of data to report in statewide, to be able to report that to our elected officials. That will help too, because then you'll have a consistent set of data from all the syringe exchange programs in Kentucky, which again increases your numbers, increases how many cases you're looking at, and will help with that. So typically, it takes a few years before you really have a decent data set to be able to make statements like that.
And we've been talking a little bit about what the needle exchange program is and will do. We want to talk a minute, too, about what it's not. And some people perceive it as, okay, this is going to eradicate the drug issue in the community. That's not necessarily the intention of the program.
No, and that's important that people understand that. The intent of this program, really, on bottom level is to prevent a outbreak of infectious disease. That is bare bones what it's intended to do. Now we do offer other services to also try to increase participation in rehabilitation services. So that's a second, as a second part of the program. When you think about resolving a community's drug problem, I really think about a wagon wheel with a lot of different spokes, because it takes a lot of different angles to work at in a community to really effectively be able to do that. And this may be a spoke in that wagon wheel, but it is by no means the wheel.
Right.
The intent really is to prevent disease transmission. Public health is very interested in participating and assisting in initiatives to prevent the engagement in drug use early on in our youth, building communities that are resilient to that. But this program alone is not the answer to that.
Right. So it's everybody's hope that one day we will be able to eradicate drug issues, but this is a program to hopefully help make the community safer for everybody, not just the people who are utilizing drugs, but everybody really.
Right.
Well, thank you very much.
Thank you.
All right, and we'll keep you up to date on the status of how everything's moving along there. This has been Gary White for Channel 6 Television.